Welcome to On the Beat. Today we are joined by doctors from Gastroenterology Associates of Columbus and Starkville. Sitting with me in the studio, Dr. Ricky Johnston and also Dr. William Gillespie. And we have very importantly been talking about colon cancer screenings, risks. We talked about procedure of a colonoscopy, but there are other ways to test for colon cancer. Where would you start to explain those?
Well, there's a few options that are probably not used as much anymore, like what's called a flexible sigmoidoscopy, which is where you go in only a limited amount of the colon, and there's some CT methods, like X-ray methods to screen for it, barium enema, where people have contrast infused into their colon via rectum and they take X-rays. Those are super uncommon these days. More recently, we've seen some stool testing, stool DNA testing, and then also a newer blood test that's being promoted as a screening method.
And with all of these screening methods, there are advantages and disadvantages. Would you explain the advantages of those different alternative methods and the disadvantages?
Well, take Cologuard, for example, it's pretty easy. You just give a stool sample and then it comes back positive or negative. It generally works pretty well. It does miss about 10% of cancers, and it also misses a lot of polyps. Yeah. So it's not quite as preventative as a colonoscopy.
Will it be able to detect any polyps?
Some.
50% maybe.
Okay, but not all.
Not
No.
all. And that's advanced polyps, high-risk polyps. Like smaller
Right.
polyps, much probably lower percentage.
And
than
the
that.
other thing with Cologuard, we're seeing a lot of people that get Cologuards that probably shouldn't get Cologuards. It was studied and approved in a very cherry-picked population that had no family history, no history of polyps, no symptoms. And so those are the appropriate people to get a Cologuard. But if you have a family history, you probably shouldn't get a Cologuard. If you have any symptoms, particularly bleeding, you should not get a Cologuard.
Good points.
And typically with a family history, you're considered high risk, and Cologuard has not really been studied in that population. So Cologuard's really for asymptomatic people with no family history and no issues.
Like some of the advantages might be cost. It's cheaper than having a colonoscopy. Ease. It's easier for some people to do that. But you have to have it more frequently. It's every 3 years as opposed to potentially every 5 or 10 for what we're doing. So there's some advantages and disadvantages. But to his point, there's certainly people who are getting them that probably should be seeing us for a colonoscopy instead.
And that's what I think is important is you should reach out and sit with you and talk about all those different factors to find out which procedure is best given your
some
situation.
people are getting these kits mailed to them by their insurance company. So it just shows up in their mail.
Wow.
And they, they've not been screened for symptoms or family history or anything. They're just submitting their test. There's also, by the way, a false positive rate with these tests. We see a lot of people referred for a positive result who then have a negative colonoscopy.
Wow.
And that does seem to create some anxiety in people.
Yeah.
When they have this positive test, but then the colonoscopy is negative, it can create kind of some anxiety around their health.
The short of it for me is if you have access to and you're willing to have a colonoscopy, you should have a colonoscopy.
Right.
For some people who either have health problems, they can't tolerate the prep for whatever reason, there's a very limited subset of patients, in my opinion, that are candidates for that.
Well, good to know there are lots of options. Thank you both so much. And the numbers on your screen to reach out to the doctors and find out what's best for you.